On the Medical Watch, pregnant and fighting cancer.
Our medical reporter Dina Baer has more on the delicate balance between treatment and a mother and baby's health.
1 in 3,000 women are diagnosed with breast cancer during pregnancy. For a young mother, the news came just days after learning she was expecting her second child. Among her first thoughts, can I keep my baby? That's when her doctors delivered some surprising news.
We had to do IVF for both my daughters.
It was a struggle to conceive their two beautiful girls, but for Christine and Matt Kump, it was only the start.
I was 1 day shy of 8 weeks pregnant when she called with the diagnosis.
What we see here is in the circle this kind of whitish thing that is actually a cancer in the breast. It's a mass in the breast.
Biopsy results showed the tumor was triple-negative breast cancer.
My mind, I went deep and dark. I was thinking I had to write letters to my daughter Susie for all of her milestones, because you Google these things and without having talked to a doctor or an oncologist that normally works with breast cancer patients, it was just kind of, I got some scary thoughts.
Surgically removing the mass was not an option at the time, but to the 35-year-old's surprise, chemotherapy was.
100% thought they were going to tell me I had to make a decision of cancer treatment or continuing with a pregnancy, and that wasn't. Thank goodness I didn't have to make that decision.
There are certain chemotherapy medications that are safe to use and can be used during pregnancy.
Northwestern Medicine's Dr. Dragana Tomic says the data is limited, but doctors do know timing is critical when it comes to delivering chemotherapy to pregnant women. It's not recommended during the first trimester when a baby's organs are forming, and radiation treatments and certain scans have to wait until after the delivery.
We have to keep a close eye on the baby development.
For Christine, the first 16 rounds of adriamycin cytotoxin, a type of chemo medication considered safe during pregnancy, started when she was about 14 weeks along.
We keep a very close eye on the patient, on the side effects, on the blood counts. Christine was very brave. She's one very brave and strong woman.
Throughout the ups and downs, the support she received at home kept her going.
Having my daughter here at home, my 3-year-old, feeling all the kicks and wiggles of my daughter Vivian, my husband and all of his support.
Then another surprise. Vivian arrived early. The newborn spent 59 days in the neonatal intensive care unit as her mom finished up treatment. Christine says she's sharing her story to support others facing the same challenge during what should be a joyful chapter.
I'm going to do everything I can to be there for my girls. I want to see those girls grow up.
After her diagnosis, Christine underwent genetic testing and learned she is BRCA1 positive. She plans to have both daughters tested when they're eligible, which is at 18 years old. Back to you.